Okay, this is the side lying thoracic extension or open book exercise. Have the knees and hips slightly flexed to 90 and arms straight in front. Reach top hand back and rotate through ribs, not lower back. Keep knees stacked and eyes follow hand. Perform 5 reps. This is the Sphinx stretch. Have the patient prone on their forearms and elbows under the shoulder. Press sternum up and extend through the back, but avoid lumbar sag. Keep your ribs down and chest forward. Hold for 30 seconds. This is the quadruped T-spine rotation. Have the patient's hands under their shoulder with one on behind the head. Rotate elbow towards ceiling, but keep hips square under the hips. Exhale as you open up and keep belly gently braced. Perform 5 reps. This is a thoracic lunge exercise. Have the patient in a lunge position, both knees at 90 degrees, and rotate the upper body to the right and left, going slowly. Make sure they reach as far as they can in both directions. Perform for 30 seconds. This is a thoracic rotation exercise. Have the patient cross one knee over the other and rotate in the direction of the bent knee and use the opposite arm to push through as far as they can and have the patient hold for 30 seconds. This is a stretch for the gastroc muscle that is normally tight with lower cross syndrome. You have the patient lean towards their front leg and keep their back leg straight. Hold for 30 seconds. Okay. This is a stretch for the soleus muscle that is typically tight with lower cross syndrome. To stretch, keep the knee bent while extending the leg behind and leaning forward. Make sure the back knee is also bent. Hold for 30 seconds. This is a stretch for the post tib. Have the patient use a slant board or a wall and dorsiflex their foot up and evert their foot out. Hold for 30 seconds.
Is it eversion? Am I tripping?
Mm-hmm. This is a stretch for the hip adductors that are commonly tight with lower cross syndrome. Have the patient hold a 30-second butterfly stretch. This is a stretch for the hamstrings. It's a single leg lift, so have the patient lift one of their legs and have them keep their knees straight. Hold for 30 seconds.
For the active stretch, we'll have the patient use a chair step onto the chair, and with the hands on their hips, lunge forward slightly and hold for 10 seconds. For the active stretch, we'll have the patient put their foot onto a chair or wall, and with the opposite leg, hold a lunge pose and rock back and forth until you feel a stretch, and then hold for 10 seconds. The active stretch, we're going to get on one knee, bring the other in front of the body, align foot in front, and line it with the back knee, and slowly lean forward, similar to a lunge, so you feel a stretch, and hold for 10 seconds. For the active stretch, we'll have the patient position themselves in child pose stance with their hands reached out above their head, and then we'll have their butt sit back onto their heels with their lower back slightly rounded, and hold this position for at least 10 seconds. For the active stretch, we'll have the patient on the ground with one leg out 45 degrees and the other one with the heel towards the groin, and we're going to have them lean towards the side with the knee flexed, and just hold that for 10 seconds. For the active stretch, we'll have the patient on their knees on the ground, and we'll use a chair, and we're going to lean into the chair with both hands on it and slightly lower the butt to the heel and hold for 10 seconds. For the active stretch, the patient will perform the motion by himself, flex the hip until I rotate the leg, and drag the knee across to the other hip. Thank you.
This exercise is a side leg raise. It's for the glute minimus, which is typically weak with lower cross syndrome. Have the patient lie on their side, legs straight, and lift their one leg on top of the other and have their top leg lift as far as they can. Do 15 reps and switch to the other side. They can use their arms to stabilize themselves. This is a strengthening exercise for the external and internal obliques, which are typically weak with lower cross syndrome. Have the patient perform a side plank with their feet on the ground, their top foot on top of their other foot, and their arm bent to 90. Performing rotations, make sure that you reach both obliques, and perform 15 reps.
This is a hamstring strengthening exercise, which is typically tight and weak in lower cross syndrome. So this is called a leg pull down. The patient's going to lay on their stomach and bend their knee to 90 degrees. And you're going to have the patient try to pull their leg down against resistance.
This is a strengthening exercise for the glute max, which is typically weak with lower cross syndrome. Have the patient perform a glute bridge with their knees bent to 90 and their butt raised. Have the patient hold for 30 seconds and perform at least 5 reps. This is a strengthening exercise for the multifidus. It is a bird dog. Have the patient raise opposite arm and opposite leg while on their hands and knees. Make sure the patient keeps their core tight and to not move it. Have the patient perform 15 reps per each side. This is a strengthening exercise for the transverse abdominis. It is a dead bug. Have the patient lie on their back, their knees and hips to 90 and their arms raised above their head. Have them lower their opposite arm and opposite leg at the same time and vice versa for the other side. Perform 15 reps per each side while keeping their core tight.
This is a hamstring strengthening exercise. The hamstrings are typically tight and weak with lower cross syndrome. So the patient's going to lay on their stomach and bend their knee to 90 degrees. The trainer's going to pull the leg down and the patient's going to resist, and you're going to hold that for 30 seconds. This is an anterior deltoid stretch, which is typically tight in upper cross syndrome. So the patient is going to place their arm flat on a stretching device. So for this example, it's a wall. And they're going to turn away from the arm that's against the wall to stretch out the anterior deltoid, and they're going to hold for 30 seconds. This is a stretch for the coracobrachialis, which is typically tight in upper cross syndrome. So the patient is going to stand facing the wall. They're going to make their hand into a fist and raise it so it's touching the wall. And then they're going to rotate their body away from the side that is touching the wall, and they're going to hold that for 30 seconds. This is a stretch for the long head of the biceps tendon, which is typically tight in upper cross syndrome. So the patient is going to stand in between the doorway. They're going to place their arm against the doorway like they're high-fiving the door, and then they're going to rotate their body away from the arm that's against the door, and they're going to hold that for 30 seconds.
For the active stretch, we're going to find a doorway and repeat this motion as if we were doing a push-up, and take one step forward into a slight lunge to really stretch the pec major. For the pectoralis minor stretch, once again, we're going to find a doorway. We're going to have the wrist and elbow lined up from a 90-degree angle with the wrist. And once again, take one step forward and lunge into the stretch. For this test, we'll have the patient sit up nice and tall, and the clinician will apply pressure to one shoulder and then push the ear towards the opposite shoulder. We'll hold the stretch for 10 seconds. Now we're going to demonstrate the active stretch where the patient applies the pressure himself and continues the stretch to the opposite shoulder. Hold for 10 seconds. For this test, the patient is going to turn their head 45 degrees towards their shoulder, and on the opposite shoulder will apply downward pressure while also tilting their head towards their armpit. We'll hold the stretch for 10 seconds, but in an ideal clinical scenario, we can hold this stretch for 30 seconds and do 3 reps, and this goes for each exercise. Now, she's going to actively demonstrate this stretch actively by applying the pressure herself and tilting her head towards her armpit. For this stretch, we're going to apply pressure to one shoulder and to the opposite shoulder. We're going to laterally flex the neck and then slightly rotate towards the ceiling, extend the neck back. We'll hold this stretch for 10 seconds. Now for the active stretch, we're going to hold the origin of the sternocleidomastoid, and the patient will apply the pressure himself while performing the same movements to get into position. For the passive stretch of this exercise, the clinician will gently extend the neck and tilt it towards the side. We'll hold this for 10 seconds. Now for the active stretch, the patient will perform this maneuver without assistance. To stretch for the suboccipital, we're going to put our hands on the lower base of their neck and slightly flex their neck forward. We're going to hold this stretch for 10 seconds. And then to demonstrate the active stretch, we'll have the patient apply the pressure and flex their neck down. Hold for 10 seconds.
This is a strengthening exercise for the cervical flexors, which are typically weak with upper cross syndrome. Have the patient lying on their back with their head in neutral and stabilized. Then have the patient perform chin tucks, bringing their chin to their chest and holding for 5 seconds, and repeat 10 times. This is a strengthening exercise for the posterior deltoid, which is typically weak with upper cross syndrome. Have the patient sitting in a chair, knees bent to 90. Then have the patient bend over and perform back row, which is bringing their arms up and down. Hold at the top for 3 to 5 seconds and perform 3 to 10 sets. Add weights for further difficulty. This is a strengthening exercise for the supraspinatus, which is typically weak with upper cross syndrome. Have the patient lay on their stomach and face down. Have their arm be brought into an L position with their palm facing down. Then the patient lowers their hand or weight to increase difficulty towards the ground as far as they can go, and have a hold. The patient then repeats for 3 sets of 10. This is a strengthening exercise for the rhomboids. Have the patient, which is typically weak with upper cross syndrome, have the patient lie on their stomach with their head in a neutral position. Have the patient bring their arms up and create a fist with their thumbs out. Have the patient bring their arms up as high as they can, hold for 5 seconds, and have the patient do 3 sets of 10. You can include weights for further difficulty. This is a strengthening exercise for the medial deltoid. Have the patient standing with a weight in their hand. Have the patient abduct their arm to 90 degrees and hold for 5 seconds. Repeat for 3 sets of 10. This is a strengthening exercise for the infraspinatus, which is typically weak with upper cross syndrome. Have the patient have a weight to increase difficulty, but it's not necessary, and bend their elbow to 90 degrees and keep their elbow tucked and externally rotate their arm as far as they can. Perform and hold for 5 seconds. Perform 3 sets of 10.
This is a strengthening exercise for the serratus anterior. So the patient is going to stand at the wall with their palms touching the wall at shoulder height. They're going to lean into the wall, protracting their shoulder blades. They're going to hold for around 3 seconds. They're going to come back out by retracting their shoulder blades. You want to make sure they keep their arms straight, and they could do 3 sets of 10 for this.
This is a strengthening exercise for the lower trapezius. The patient lays on the stomach on a table and on their elbows. The patient tucks their head into one crook of their elbow while putting the other hand behind their head. Then they perform to bring their elbow up into the air and raise it and hold for 5 seconds and perform 5 reps. This is a strengthening exercise for the middle trapezius. The patient lays down on their stomach with their head in neutral position. The patient then raises their arm into a T position, and then they raise their arms even higher to squeeze their scapulas together. Have the patient hold for 3 seconds and come back to starting position. They then perform 2 to 3 sets of 10 reps. And to increase difficulty, you can include weights on their arms.